Hi friends, I'm Dr. Mohammed. Thanks for watching. Now let's talk about Claritek tablet uses, side effects and price in Pakistan. Claritek is a macrolide antibiotic prescribed for an array of bacterial conditions including acute otitis, pharyngitis, tonsillitis, respiratory tract infections, skin infections. Avoid misusing antibiotics as they can cause resistance and other adverse effects. Consult a doctor for a prescription before using antibiotics. So here is the mechanism of action of Claritek. Claritek containing Clarithromycin combats bacteria by binding to the 50s ribosomal subunit, inhibiting protein synthesis. It's effective against a broad spectrum of aerobic and anaerobic gram-positive and gram-negative bacteria. Claritek's price in Pakistan ranges between 33 and 35 rupees per tablet. The exact tablet price can vary depending on the strength of the tablet. Some of the major uses of Claritek tablets include lower respiratory tract infections. Claritek 500 mg or 250 mg effectively combats lower respiratory tract infections caused by susceptible bacteria, whether it's bronchitis characterized by inflammation of the bronchi or pneumonia which affects the alveoli in the lungs. Claritek can be the medication of choice for prompt relief and recovery. Upper respiratory tract infections. For common upper respiratory ailments like pharyngitis, inflammation of the pharynx, sinusitis, sinus inflammation, or tonsillitis, inflamed tonsils, Claritek provides targeted action against the causative bacterial agents, ensuring a swift return to health. Acute otitis media in children. Acute otitis media is a painful bacterial infection of the middle ear that's particularly common in children. Claritek can provide rapid relief, reducing inflammation and eradicating the infection, preventing potential complications like hearing loss. Skin and soft tissue infections. Skin conditions ranging from folliculitis, inflamed hair follicles, to deeper infections like abscesses can be effectively treated with Claritek. Its broad spectrum action is also suitable for cellulitis, erysipelas, and contagious and impetigo. It's used to treat mycobacterial infections. Claritek has proven efficacy against the Mycobacterium avium complex. Whether the infection is localized or disseminated, the medication can offer comprehensive treatment, reducing symptoms and bacterial load. Helicobacter pylori infections. Peptic ulcer disease, often resulting from Helicobacter pylori infection, can be treated using Claritek as part of a combination therapy. By eradicating H. pylori, the medication assists in promoting ulcer healing and preventing reoccurrence. Prophylaxis of endocarditis. When penicillins aren't an option, Claritek stands as an alternative for the prevention of bacterial endocarditis, especially for at-risk patients undergoing dental or surgical procedures. This medication can be safeguard against potential cardiac infections. Follow these instructions when taking Claritek. Take the tablet with a full glass of water. Avoid crushing or chewing. It's best taken with food due to its extended release nature. Take the medicine in the prescribed dosage and at the same time each day to prevent antibiotic resistance. Always inform your doctor about pre-existing conditions, the medicines you are taking, or the allergies you have. Some of the most common side effects associated with the use of Claritek tablet include stomach upset, headache, paresthesia, nausea and vomiting, stomatitis, glossitis, diarrhea, etc. If you experience any serious side effects, call your doctor immediately. Use Clarithromycin in pregnancy only if the benefits outweigh potential fatal risks. As studies in pregnant women are limited, for nursing mothers, Clarithromycin and its active metabolite are present in breast milk, which may lead to diarrhea or fungal infections in breastfed infants. Weigh the mother's treatment benefits against potential risks to the infant before use. Avoid over-the-counter use of antibiotics and consult a doctor for the prescription use. The dosage of Claritek tablet depends on the prescription. It can be taken every 8 hours 3 times a day or every 12 hours 2 times a day. The overdose of Claritek is associated with symptoms such as antibiotic resistance, nausea, vomiting, dizziness and drowsiness. I hope you liked the video. Please like and share our channel, subscribe to our channel. Thank you.